A couple did everything right. Paid off the house, maxed the 401k, retired at 62, exactly on schedule. Then one piece of mail showed up. A health insurance quote.
And the number was so big, they unretired 3 weeks later. Here's the thing nobody warns you about. There's a 3-year trap between the day you retire early and the day your real benefits kick in. And that trap has quietly pushed more people back to work than any stock market crash ever has. By the end of this video, I'll give you the one number to add to your retirement plan, so this never blindsides you. And stick around, because the biggest mistake isn't the price tag. It's something people do with their own money that accidentally triples the bill. That's at the end. So let's start with the trap. You know Medicare, right? The government health coverage for retirees. Quick question. What age does Medicare actually start? Most people guess 62, some guess 60. Nope, it's 65. Every single time. So if you retire at 62, you've got a gap. 3 full years where your job's insurance is gone, and Medicare hasn't shown up yet. For those 3 years, you're on your own. And on your own, in America, gets expensive fast. So how expensive? Let's use real 2026 numbers. When you don't have a job plan, you buy your own insurance on the marketplace. Healthcare.gov. You've seen the ads. Here's the part that stings. By law, insurers can charge someone in their early 60s up to 3 times what they charge a 21-year-old. Same plan. So a healthy 62-year-old buying a mid-level plan at full price? You're looking at around $1,000 to $1,200 a month. Let that sink in. That's not a year, that's a month. Call it 12 grand a year per person. Over the 3-year gap, that's about $36,000. And if you're a couple, double it. $70,000 just to stay covered until Medicare. That's a number almost nobody writes into their retirement plan. And it's exactly why that couple panicked at the mailbox. Mid-video re-promise plus engagement. 3 minutes to 3 minutes 20. Now, quick gut check. Drop it in the comments. What age do you want to retire? I actually read these. And here's where it gets worse. Because right now you're probably thinking, relax, there are subsidies. The government helps pay for this. You're right, they do. But in 2026, that help comes with a cliff. And one wrong move sends you straight off the edge. Okay, the subsidies. The official name is premium tax credits. For a few years, the rules were generous. Big help, lots of people qualified. Those souped-up rules expired at the end of 2025. Gone. So in 2026, we're back to the old brutal version. Here's how it works. If your income is under a certain line, the government covers a chunk of your premium. Great. But go even $1 over that line, and you lose all of it. Every penny. They call it the subsidy cliff, and it is not gentle. Want to see how steep? Real numbers. A 60-year-old earning $62,000 a year pays about $515 a month. Manageable. Same person, same plan, but now they earn $64,000. Their cost jumps to $1,244 a month. Read that again. $2,000 more in income. Cost them about $730 more every single month. That's not a typo. That's the cliff. Stage. And here's the cruel twist for early retirees especially. When you're not working, you create your income by pulling money out of savings. Sell some stock. Take a big 401k withdrawal. A pension kicks in. Do too much of that in 1 year. And on paper, you look rich. Rich enough to fall off the cliff. So you can have $1 million saved, feel totally broke on premiums, and still get zero help. Looking rich on paper is the exact thing that disqualifies you. So here's the payoff. The one number I promised. Stop thinking about retirement as just, how much have I saved? Start thinking about the bridge. The healthcare bridge from 62 to 65. The math is simple. Take your expected monthly premium, times 12, times the years until you hit 65. One person, $1,000 a month, 3 years, that's a $36,000 bridge fund. A couple, around 72. That's a line item now, right next to your house and your car. You don't retire on your savings. You retire on your savings minus the bridge. And once it's written down, two things happen. 1. The mailbox stops scaring you. 2. You can actually plan around that cliff instead of falling off it. Remember the biggest mistake I teased? The one that triples the bill? Here it is. People retire, and in their very first year off work, they yank out a huge chunk of cash. New truck, dream trip, pay off the last debt. Totally reasonable, except that giant withdrawal spikes their income for the year and shoves them right off the subsidy cliff. They didn't get poorer, they got a bigger bill, just for spending their own money at the wrong time. That's the part nobody tells you. It's not how much you spend, it's when. So that couple, the ones who unretired, they didn't have bad savings, they had a blind spot, a 3-year gap and a cliff nobody warned them about. The people who retire at 62 and stay retired aren't richer than everybody else. They just planned for the bridge. Quick reminder, this is general information, not personal financial advice. Your real numbers depend on your state, your income, and your plan, so always check your own situation. But if this changed how you think about retiring early, hit subscribe, so the next big money decision hits different. And watch this next. I'll show you the exact moves people use to legally cut that healthcare bill nearly in half before they ever turn 65. It's easier than you think. See you there.